Hey, what's up? What's up? What's up, peeps? What's up, family? Now, today I have a very important guest with me today. Her name is Carnisha, and she fell ill probably a few weeks ago with a sickness which probably a lot of us are not aware of, or some of us have never heard. And
Mm-hmm.
she's there today with me today to share it, to share the symptoms, to share her feelings before and after, and what she's still feeling. So I introduced to you Carnisha. Carnisha, introduce yourself.
My name is Carnisha Brown.
Okay.
Mm-hmm.
So Carnisha, man, it's so hard to call the name of the sickness. What's the name of that sickness?
It's called trigeminal neuralgia.
Okay.
Mm-hmm.
So before we talk what it is,
Okay.
I want you to start from before you know what it is and what you were feeling and how you came to find out this is what you actually got.
Okay. So first of all, I before I start saying all of this, I'm not saying it's what I was wearing or what causes it because we still don't know fully. But
Okay.
I was wearing Invisalign, where is the plastic thing that you put over your teeth. I had gap.
Yeah.
Well, I still have the gaps because they're back. I I was born with gaps, and I wanted to change it as in closing the gaps, and I started wearing the Invisalign for like 2.5 years. I was wearing it, and
Okay.
before I start, if you hear me kind of stutter sometime, I'm on some meds. So it
Mm-hmm.
kind of let me kind of have to stop, like, just to figure or think what I'm saying. So forgive me if I'm
Okay.
having a little stutter. Yes,
Okay.
so I was wearing the Invisalign for 2 years, 2.5 years. And I never had any symptoms or anything. I never had any problems except for just pain with the Invisalign, just to arrange your teeth and all of that. And then um I think like a week after I stopped wearing the Invisalign and the retainers where you get the permanent retainers to wear only at nights now.
Mm-hmm.
I remember I went to work and I was having these little twitches in my, especially this side, the right jaw. I was having twitches, and I was like, what, you're feeling something different, so you're wondering what it is. But
Okay.
anyway, still going to work and everything. And I remember one morning I was looking after a patient of mine, and it hit me so hard I screamed out, and my patient was like, I think you need to go to the doctor because I have never seen you, in so much pain or anything. So I think you need to
Mm-hmm.
go to the doctor. So I took that patient's advice and I went to my primary doctor, and in which he said I had some clogged ears and they washed it out, which only two flakes came out of my ears. But anyways,
Mm-hmm.
yeah. He gave me some meds, some pain meds. He gave me some gabapentin, which is some anti-seizure medicine, and some what they call it, some ibuprofen 800 and some muscle relaxers to take every 6 hours, the muscle relaxers. Mind you, muscle relaxers are pretty strong, so while taking it, you have to be careful driving and all of that. I was going to
Mm-hmm.
school and I was trying to keep dehydrated and everything, and the pain was coming more frequently, and I'm like, something is not right. Went back to my doctor, primary doctor, and he said, I think you need to see a neurologist. Went to my neurologist, and the neurologist told me that I have trigeminal neuralgia. Of course, that big word, it took me like couple months to pronounce that word because I didn't know what it was. Honestly, I didn't do any research that much about it. All I knew was that it was something. All he told me, so I was going off base. He was what he told me. He said, "Tell you what, you need to do an MRI, but I'm gonna give you some meds, and if the medication helps, and you think that hey, the meds are okay, you don't, and it's up to you if you want to do the MRI or not." So of course, I asked him, I said, what exactly am I dealing with? He said, you have, like I said, trigeminal neuralgia. And it's something that you have to live with. You have to be careful how you brush your teeth. Just touching your face, it can triggers it. And of course, by touching my face, it did triggers it. Brushing my teeth, I could hardly chew. Just about basically anything that you do over here. You talk too
Okay.
loud, twitches, all of that. But I was having a lot of spasm in my face. When I say spasm, it keeps, a lot of contraction. So um
So
went
it
back
was
to
just your face though, or
not
your whole
all
body.
not all my face. No, it's just right here. Your ear,
Oh.
all the way, yes. So I said, so what do I do about it? He said, there's nothing you can do about it. All you have to do is just take your meds. And then he went up on the dosage. I was taking, of course, 2 times a day. He said, oh, these meds are to be taken 3 times a day. And I'm gonna go up by 400 milligram, and you have to just take it. I said, what about the muscle relaxers? Because he said it's you don't have to take it, but it's as needed. Okay. He's a neurologist, of course I took it. His advice.
Mhm.
I was going to school and I tell you no, like one day I was in so much pain. I could hardly talk, so I took the muscle relaxer. I was in class and I couldn't even focus. I had to call my doctor and I said, I have to come back, you know, and thing. He said, okay. Went back to my doctor. He said, you just have to take the meds. You're back and forth with doctors. That's all it's saying. Take the meds. None of them actually sit you down and said, okay, maybe you're coming on to a flare up. Nothing. You
Mhm.
just went to a doctor and he's like, oh, you have to take the meds. So I'm trying to take the meds and it keeps coming on more frequently. Got me a new job now, and that's when in January. And oh God, it was so hard. I could hardly eat. When I tell you I could hardly eat now, I had to depend on Ensure just to take a little to take
Um,
it.
so
When
so Curtis, how long did all this took place? Like how long
basically a
it took?
month,
A
basically a
month.
year I've been going through all of this. A whole year. I've been going through back and forth with doctors and
That's
all of that.
before you know what it was, right?
When actually the flare up starts in Jamaica in January, sorry. It started
Mm-hmm.
in January. To be exact, this week would be four weeks complete. Yes, today would be 4 going on 5. Honestly, I can't even remember, but I know it started in January, about the 4th of January. Because I remember one Saturday night I did a 12-hour shift and I got off at 11, I think 10 o'clock. I got off, and I was in so much pain. I told my husband I drove myself to Conway Hospital, and it was pretty cold. That's when it was getting to the cold time, and I
Yeah.
was in so much pain. I don't know how I got to the hospital, but I went there and I said to the nurse, I told her, the admission people, I tell them what was happening, and they were like, okay, let's get you in. And when I went there, they gave me a shot, and the lady said, there's nothing we can actually do than to just try to give you a shot to kind of calm you down so you can, because I
Mm-hmm.
told her I'm not sleeping. I was not
Okay.
sleeping at all. So I got the shot and I got home and I took a warm shower. Didn't know that that helped, but I did took a warm bath, and I think it kind of calmed my body down, and I went to bed. Got up to do another 10-hour shift. Went to work and I was in so much pain. I had to tell my manager, I said, I'm on, to tell you the truth, that time he went up on my neurosurgeon went up on my meds again. So I'm taking 800 milligrams every 3 hours. Plus, I took a muscle relaxer
Mm.
and it make no difference. None. I went out with my clients, and Chris, I tell you, I sat there and I was in Wonderland, but I had to push through the pain. Push through the pain. And when I got home, when I got to my client's place, I said to her, my house manager, I said, please, I have to hide behind the camera. I said, if you see me, not showing up, in front of the camera or whatever. I don't want them to see me dozing off because I took some muscle relaxer. So I'm just letting you guys know. She said, okay, I understand. And that particular Sunday, I was working that 12-hour shift by myself. I don't know how I did it. I don't know. But I pushed through, and when it was time to go home, it felt like I don't even know how to explain it, but I tell you, I pushed through and I was praying and I took the pills and I came home and I was so hungry that night. I boiled some banana. One of the main triggers are bananas. I did not know. And I boiled
Okay.
some, but not triggers, one of the food that you're not supposed to eat. Banana,
Mm.
I read up on it, bananas, oranges, and any citrus thing you keep away from that, and bananas don't, and I'm a lover of banana. And
Okay.
night I came home, I bought some bananas and I took like 3 bites, and the third one, you didn't want to hear what came out my mouth.
Mm.
Yes, and I said, "Mm-mm, something right," and I went back to sleep. I went to sleep, sorry. When I got up, okay, that was it. It's like my right side, it was tingling all over. It was fire all over. My brain was on fire. When I tell you my brain was on fire, literally on fire. And I
Yeah.
called my husband and I said to him, and I always tell persons, you ever imagine or seen two electricity wire gashing side to side?
Mm-hmm.
Just imagine them come together.
Mm. That's what
Same.
you were feeling.
Yes. And I called my husband same time and I said, come for me. And he was like, what happened? And I could hardly talk. And I said, come. I said, I'm dying. He said, what is wrong? But he didn't probably, I don't know, he probably didn't pick it up. I said, please come for me. I'm
Mm-hmm.
dying. And he was like, what's wrong? And I, cause us Jamaican.
Yeah.
Yes, I let go the bad word and I said, me a dead. And I just
Yeah.
hung the phone up. And the next thing, I know it's like my 5 year was there and she saw that I was crying. I said, Lord, help me. I'm dying in front of my daughter. And the next thing I know, I grabbed the phone and I put it on the stand on my dresser. And I just be scrolling. Who next to a call? And the devil, not devil, God said, your mother. And she was at, what they call it, fasting service at her church. She lives in England.
This was night.
No, in the morning, Monday morning. After the Sunday,
Um,
I did the 12-hour shift. I was supposed to go back Monday to work at 2 o'clock. And when I called my mother, one ring, the phone ring. She answered. And I said, Mommy, this is it. And she said, what happened? I said, pray. That's all I could say, pray. And she was at fasting and she screamed out, and everybody in her church, reacted to her. And
mm.
all I know, they were praying. And this is me. I couldn't do anything more than the eye water running out my mouth. I'm drooling, all of that. And all my baby was like, Mommy, Mommy. And she trying to touch me, and I just tried to use my left hand just to keep her off. There's nothing. And I tell you, just the movement of my hand, the pain come on. And I mean, electricity, this time it wasn't just in my face alone. It was neuropathy. It was like if you touch even my nails, and you see how my nails are a bit long, if you even touch it, Chris,
Fucks.
yes,
Yeah.
shock. And that even make it worse. And I tell you, I scream and I cry. I said, Mommy, help me. And my mommy dear and said, believe, believe. And all I could do is just lean to the right side and I'm drooling and I'm crying. And this is me. I'm like a zombie. My husband came and he was trying to touch me. And I said, don't. I just have to keep him off. And he said, take a deep breath. It's cold out there. And I knew that just coldness would probably affect my face, but I didn't know it was that severe. I didn't know
Yeah.
how, because this is my first flare up. I didn't know
Mm-hmm.
nothing about it. And I said to her, I said, Mommy, not Mommy, I keep, and he said, you have to cover yourself because it's pretty cold. I couldn't take myself out my pajama, nothing. You ever hear when they say when trouble take you, where you go? Okay.
Mm. So at this time, Kanisha, what you feel your body was like dead, or you still
Well,
feel life, or what's the
neuropathy,
feeling?
neuropathy wise, like I said, if you touch any part of me, it brings the sensation more severe. You
Oh,
know, it bring it
yeah.
to the,
And it
I
goes
knew.
right to your brain. Everything.
Yes, yes. My left side was okay, but because I was so scared and because I was, this is my first time. I've never had it. I don't know what it was. I wasn't mentally prepared. Although a person can never be mentally prepared for
Yeah.
pain. You
Yeah.
get what I'm saying?
Right.
So with that said, I'm in so much pain. I don't know what to think. I'm scared. Then my poor baby there crying. I don't know how to react. So I keep
Mm-hmm.
telling my husband, don't touch me. But he handled it very good. Thank God for him. And he said to me, he said, you have to try to calm down. I know it hurt. And one of the time when the pain lit me, I may scream out. He said to me, and that's when I kind of, thank you, Jesus. He said, use me as your pain barrier. You ever hear person say, I don't know if persons do believe, I don't know, honestly, but I know for a fact when he said, use me, he said, grab my hand, squeeze as tight as possible because he
Mm.
could not hug me. So he said, grab me. That's the first. He said, squeeze as hard as you can. And when I grab him, you see, and when I squeeze and I start, me couldn't scream, but me think me I scream. And when
Yeah.
he jump and me grab him, I tell you,
Mm-hmm.
man, you can see the tears in their eye. If you say, oh God, what can I do? But that helped a little. He was there as my
Transfer
husband.
the
And
thing.
yes. And when it kind of calmed down that time, me I tell you this on my brain. And my jaw have this spasm and this is how it's going, and I don't know how to, it's like I don't know how to respond. It's like I'm preparing, like I'm ready, like okay, one more to come. That's how one, so it come on and it ease off, it come on again, and this is how it's going. And then he said, I know it's hard but you have to try. And throw the big coat over me, have an what they call it, thing to wrap around my face. He said, we have to go outside, we have to get it to the doctor. Went in the car. The slightest a bump, baby, it bring it on.
Mm.
I have to sit like this in the car and in drive. Even though in my drive fast, in my drive, he's so cautious and he's so mad because he can't reach at the hospital fast enough. And he was like, "I gotta get you there," But boy, I tell you, it not nice. That's all I can say. It's not nice, Chris. That pain, not nice. So got to the ER now. The nurse, when I got there, he said, you want to get a wheelchair? I thought I could sit in the wheelchair, so I said yes. The minute I got out the car, it took me forever to get out the car, but I know it wasn't probably like, it wasn't long, but it took me forever because I have to
Mm.
gear up for the pain. And every time the pain come on, I have to just try to tense. But I think the more I tense, I think that hurt more because they're using up your nerves.
Yeah.
So I got out the car and I got out the car and I stood there and I was rocking, and he said, we need to go inside. I said, okay. And he went for the wheelchair. I couldn't even touch the wheelchair. When I tell you I literally couldn't touch it, I said, mm-mm. The minute I tried to sit, the pain come on, I said, what you do? You better stand up. I have to stand up. And I say, I walk and I take my own little time and I walk, and him have to stay behind me just in case I try to fall or whatever. That went in there, the nurse came out and she said she need to be sitting in the wheelchair. He said, don't even try touching her. But they didn't know what it was. But because I went to
Yeah.
contact and they gave me the paper with the thing on it. So all I could, because I couldn't talk, I had it to show them.
I say could have talk.
No, that time now it's like, hear me say you couldn't even move your tongue properly without
So your
electricity.
face like your face dead.
In numb. Not
No.
over here. Over, well, maybe.
Just one side.
Just right
So they
from.
come like they catch your strokes.
I've never gotten a stroke, and I'm not gonna say come let me catch a stroke, but that boy, if a stroke feel, easy.
That's how normally hear them say strokes kill one side of your body and then one side is paralyzed.
That's good.
Like you
So
just feel
so
like it was paralyzed.
yes. So now that when I went to, well, going on to that, I don't want to fast forward. So when I went to the when I went in there, and the gentleman who was doing the, what they call him, he said, or you asked my husband whatever, and he said she went to the ER before, and this is what we got. So I think the pain is more severe and all of that. And they put the wristband on and said, okay, we're gonna send her in, and we went in. And Chris, Jesus have mercy, come like the pain turn up. When I went inside the room, and the nurse said, "Okay, we're going to put a thing." I said, "Don't I don't know where the spirit, not spirit, where that strength come from." Wayne said, "Please don't touch her." When I tell you, no, nothing can touch me. My
Mm.
body under fire. Me brain, not my body. My brain under. Lord God, just talking about it. I tell you, if only, and then these doctors, they don't inform you. That's the most painful part of all of this. They don't inform, even though they don't even know. They definitely don't even know what this is. And when by talking to different doctors, even in the ER, and they be saying it's trigeminal neuralgia and it's a pain this, and they need pain management. Listen, no regular pain or pain medicine, not even morphine could stop my pain. I got two morphine shots. You hear what I
Mm.
said? Plus I got another one. I think it's a steroid because I think they gave me steroids too. You hear what I said? And after the morphine shot and then another shot in I think they gave me two of them in my IV. Eventually she said, we can't they can't give me any pill because I won't be able to swallow. She said I'm gonna have to tense, not tense, I have to try to relax for them to get the IV in. And I said, okay. And when they were doing it, I be crying. Now, this time I can't scream. I can't make too much noise now because just the sound of my voice hurt me. I have people standing and she said, you have to sit. I said, I cannot sit. Wayne said she cannot sit. She can't sit. And I tell you no lie. When they give me the morphine, I don't know if you ever gotten it or anybody ever gotten it, but when you get any pain meds through IV, you literally can
Mm.
feel it in your body. It give you
I
that
can feel it going down.
it give you that dancing feeling. And let me tell you something. When I get that dancing feeling from the morphine, that pain in my brain or wherever it is, it just a dance with the morphine. So like it has said, make no sense because this now do nothing. You hear me say?
Mm.
It not do nothing. I went to do a CT scan and throughout that just going down on the bed hurt me. When I finish do the CT scan and when I come up, it hurt me. They have to be so talking to me and say, please, I know it hurt, but it's just for your good, just to try to comfort me. And
Mm-hmm.
I want to tell them so bad. It's not me, it's just the pain I'm in. It's just the pain. It's like something stabbing me. Like Chris, it feel like something. Another thing again can explain. You ever get burned like with hot oil or whatever and that big bubble? You ever get
Yeah.
burned?
Yep.
You know
Mm-hmm.
when you feel that water in it, how we have that heat inside.
Mm-hmm.
You remember get when it rub off how that tense.
Oh yeah.
Okay.
Yeah.
That's how it is in my brain. Yeah.
Mm.
So it's not like it's something can shut off. It just on constantly.
Yeah, because not to cut you, but I do some reading on it, and
Yeah.
they was saying that like it's never gonna go away.
Well,
It's
that's
just
what
gonna
it
go
can.
down,
Yeah.
then it clear up, and it go down, and it
Yeah.
probably go up for a year, and then
Yeah.
it come back.
And when they
It-
come back, they say they come back with a vengeance.
yeah, so that's what they was saying, like it's a lifetime. Well, God is God. We don't believe in
Yeah,
that.
me not
But,
believe in that. I me believe that
yeah.
healing is possible. Trust me. I do believe that healing is possible. And I leave everything in a God hand. I have praying family members. I have a praying mommy. I pray two praying sisters. I have cousins. Oh God, let me tell you something about family. If you don't have, I know that families are bad and I know that families are good, but let me tell you about my family. If it never because of them mentally, I would go crazy. You hear me tell you? The pain was so severe, and I'm not telling anybody. Well, me not gonna say me not tell nobody. The first time when I was in the ER and when the morphine was not working and I did the CT after I did the CT scan and I come back, come like the pain come back with like it worse. It was getting
Mm-hmm.
worse and worse. And I'm not ashamed to tell anybody, but now I understand. And it was after I made that attempt and I read more about it. I know and I know I believe why they call it the suicidal disorder. Yeah. Read about it. It's called the suicidal disorder. This thing will lead you to kill yourself. I promise you. I made 3 attempts to kill myself during the flare up.
Oh,
Time. The first time
yeah.
when I run inside it, when the pain lick me and me depend me morphine. When the pain lick me and me run in the middle part of the hall. I was looking for a tray for anything just to do this in my head. It made me go crazy and I went back in and I scream out. I said, "Oh, no, help me." I said that me I got dead in here.
That's when in the hospital.
Ask my husband.
So, so them gonna find anything to calm you down, your
They
pain
get
and
the head doctor came in and he said to my husband, they're going to have to give me something stronger than the morphine, which is I think a Percocet or what they call it.
yeah, Percocet.
And you see when they inject that in my IV, you ever hear them say you have a halo? You ever hear them say that you're swing, you hear the birds them or whatever? Yeah. I tell persons you will never understand until you're in somebody's shoes and it's true.
That's
You
true.
ever hear a person said when you see somebody and they go crazy or never judge anybody? And this is me.
Mm-hmm.
I've never been a judger. I've always I'm a listener. I love to listen. And I never judge a person who commits suicide. That no means so if you do it. But I've
Mm-hmm.
never judged anybody. I've never
Yeah,
judged a person who is
you
going through
don't know what the
depression.
person is going through.
No. I went in
Mm-hmm.
there and I told my husband, I said, I'm ready to die. I said, please kill me.
Oh,
He said, no, I can't. I said, kill me. I can't do this no more. And when they give me the Percocet or what they pronounce it as, the halo over my head, and the doctor came in and told my husband, he said, I don't know what else to do. It's like that's the interpretation I get from him because I was high, so I couldn't hear word for word, but I know I saw him shaking his head to my husband and he was talking to him. And he
wow.
said, all you need to do, you have to bring her home for her to sleep it off. Mind you, I'm in a ER and you're sending me home to go and sleep it off.
Send him home.
What that sound like? They can't do anything.
Yeah,
Anything.
send him home to die. That's basically it. Because
And
when you're in a situation and doctor tell us same can't do nothing, there's we are going to.
exactly. Exactly.
Yeah,
So my husband took me home. He said I have to sleep it off. I was so high I couldn't sleep. It made
yeah,
me
just
more active.
imagine.
Yeah, make me
Yeah,
more act. Make me come like out. Me couldn't move any mountain in the house, and the pain was on. It wasn't that it was slowing down, but you could feel it ticking like a time bomb ready to go off again. You see, by 9:30 in the night,
mm-hmm.
I couldn't even take my pills. Wayne had to put me back up there again, up by the ER.
Yeah,
2 times in one day, I had to go to the ER. And what they give me again? More morphine. Even though Wayne told them. I had to do another CT scan with contrast this time. Nothing. The doctors, they prescribed some other pills
but
and see.
cardiac. So at
Mhm.
this
Oh, you're
point,
fine.
them know what's causing all this thing.
Yeah, they knew because Wayne had all the papers. And then when I got released the morning, they gave me this paper from Grand Strand. Am I allowed to call the doctor the place name?
Mm-hmm. Yeah,
Okay.
public hospital.
Yeah, they gave the same kind of picture that Conway Hospital gave me. They gave me the same picture from Grand Strand
So they
and
know
with the
what's
same picture and
going on.
everything. So it's not
So,
like they just didn't know what to do because they're not neurologists. They were ER doctors.
oh, that's where the problem comes in.
Yes, because only a neurologist or a neurosurgeon knows exactly because they study the brain, right?
Mm,
So all they had to do was send me to MUSC, which is a bigger hospital with more experienced doctors or doctors. I went back when I went to that doctor, and when I did the CT scan, they said everything is okay. They're gonna prescribe some pill and they have to discharge me. I'm in pain and I have to come home. That night I couldn't sleep. I was in pain.
Yeah, because there's no neurologist there, so nobody
No,
can answer. Only thing
no.
they can do is dope you up.
I said to go back to my regular doctor. The following morning, I guess I was super high. I got some meds. I didn't sleep because I couldn't move my tongue. That time, no, it was in my tongue. The pain, the electricity was in my tongue. So this was how my
Mm,
tongue was. So I'm starting to drool because I can't swallow my spit
can
because
swallow,
my
yeah.
tongue, yeah. So I have to have this big old towel on my here just to control the drooling. I was so embarrassed, but hey, I don't really care. Call my neurologist now, and I sent an email early and they called me. Eventually he called and he was like to my husband, oh, she has to get the pill down. Wayne said she cannot eat, she cannot talk, she can't do nothing. Well, whatever she does, she has to get the pills down
Mm.
from your neurologist. Huh? That was
Yeah.
the reply I got from him. I stood there and I started crying because if he knew, or if he knows the pain I was going through, he did not even sound sentimental at all, Chris.
No,
And Wayne
it's
was
just a
like,
job.
so then he was like, okay, guess what? Two of the pill, because I got like three different pills plus my 800, three times a day. That's 1600 milligram I'm taking. He said, guess what? We're gonna have to double up on those dosage. He said to my husband, she's high now, but wait until you put her on those pills. He basically, what I interpret, he said, her brain is going haywire. You remember when I said the two wires clicking? That's what's
Mm-hmm.
happening to my brain. That's
Mm.
what, and the nerves. The nerves is under fire. So what is going to happen now? He's gonna have to give me those meds, and those are super high. So they're gonna have to, until it calms, because those are anti-seizure medicines. So they're gonna,
Mm.
whatever they do to your brain to control it.
Yeah.
Chris, this is me. I was I was high, and I had to be that high for like what, 2 or 3 days? 3 days.
What? 3 days.
Yes.
So that's like those like were the only thing that can actually help.
Or
Did they help?
anti-seizure medicine. I was high. I was still. It wasn't that severe, but my pain levels was. I wouldn't say, when he asked what was my pain level, I write, because I this time I was communicating through writing.
Mm.
I told my husband. They asked what was the pain level. I said there's no 10 in the pain level that I'm having, and I'm not telling you no lie.
It's beer. Then.
There was no 10. Again, I would encourage
No
anybody
ten
who is watching.
inside.
No. Anybody who is watching, go and do your research about it. Watch the videos. Every single soul that has um like do an interview like what we're talking, or putting their thing out there, can tell you there's no 10 in this pain. None. One morning I
So
got up. Sorry, go ahead.
so did you check it out? What's the death rate on it? Did you check it out?
It's not some, apart from a person killing themselves, it's not something that, well, it's not something that will kill you, like how
Yeah.
cancer will kill you, or cancer, let's say cancer, it's not something that will kill you. But depression, it
It's
puts
the
you in
effect from
depression.
it.
Yes, the effect of it,
Uh,
it will lead you in depression. One morning I had to call my mom and I said, please stay on the phone because I'm going to do something. But she started praying. She said, whatever it is, start praying. And I said, Mommy, I wrote it. My sister was on the phone because they're always on the phone with me. My mommy and
mm,
my sister, my niece and my other cousin, especially my mom and one of my sisters. I wrote it. She was the first person I wrote it. And I said, I can't do this no more. She said, what happened? And I said to her, I'm going to use a knife. I swear to you, Chris, God forgive me. Every time I talk about it and I think about it, that was the only thing to ease my pain. And it's the devil, you know. It's the devil. But that's the
Yeah.
only thing I think about it to ease my no pain meds. I was hungry. I couldn't eat. I had a little, you know, those little dropper that in kids' box to take meds. That was what I
Mm.
was taking water down my throat. That was
Uh,
the only thing. Until my husband, I went to oral surgeon. They did tests, nothing. I went to my dentist, not because when I contacted the persons who I was doing the Invisalign to see if they would have a little answer for me, you know, because
mm.
you don't know what is happening, and like I said,
Yeah,
my
I don't know what caused it.
nothing. When I contacted the father of the place, he said I should come and let him take a look. Then, like within an hour or so, I got another call from the secretary for the person who did mine, and she said I should go to my regular dentist. That's all she said. She said I should go to my regular dentist, so I don't have an appointment with them. I said okay. Went to my regular dentist. They couldn't help me. Get a referral. Go to a oral surgeon. Nothing. The oral surgeon said they
Yeah.
can. This has to do with a neurologist. Went to another dentist, a more kind of one that I thought would help. All I did was just sit in the chair. They said, "Open your mouth." My husband said she can't open her mouth. She looked and she said, "Okay, let me see if I can see good, just a little." Nothing. I spent $219 just to sit in the chair. And I started crying. I said, "I can't do this." I keep writing. I said to my husband, "I can't do this."
And
This
this
time,
time you still was writing.
yes, still was writing. I was writing for 1 week. Because I tell
Mm.
you, if I do like this,
You get
I
shot.
feel, me Jesus have mercy.
One tongue
And
shot.
my one tongue a shot me. And not even water I couldn't even brush my teeth. I'm not ashamed to say it. When I went to the dentist, my oral surgeon, my Wayne said, "I apologize. She can't even brush her teeth." She said she know. So they gave me some antibacterial this mouthwash to get rid of plaques and whatever just in case because I can't do it. And she said she have to try. When I start, she said use a baby toothbrush and just try to brush it. I know it's hard, but they don't even understand. They're telling you to do the right thing, but they have never experienced it. So they only can
Yeah, that's
encourage you.
true. Yeah, they know the procedure, but they don't
Yes.
know the feeling. They've never been in
Yes.
it.
My
Yeah.
tongue was
Mm.
white as the curtain. You know the plain white looking like how the paper. Yeah, my tongue was that white.
Oh.
And and I came home and Wayne said, use my hand. Hang on to him, you see. And I tell myself, then I start brush. And every brush I brush, it start bleed. Wayne said, "Oh God, something again coming up." He said, "Just do it. I know, take your time." And I take my own time. And I let the water, this thing just running out of my mouth while I brush. The tongue couldn't move because I think it was thrash. So I couldn't touch, even though I tried to touch the tongue and then electricity in there.
Mm.
You know who not touch the tongue. So I said, no, I couldn't do it. Eventually, I got to take my time. I use the mouthwash. I can't move my tongue still, but if I do little, I can't gurgle. That's how I be talking. How are you? Sometimes my mom said, don't talk, but I try. I try. I don't want to feel helpless and think.
Mm.
But by taking those high meds, honestly, it did help the pain calm down. It wasn't that severe. It wasn't.
Mm.
But the
Okay.
tongue could not, and I still couldn't eat, and I was still in pain. So my husband took me to MUSC in Charleston. Again, they gave me some more meds. And all the meds do was knock me out for like maybe an hour. Yeah, maybe an hour. And I got up. They gave me some they gave me some meds to the IV. And she said, some fluids. They gave me some fluids because I was dehydrated. Because for 2 going on 3 weeks, who wouldn't?
Definitely.
So when I got up, I felt a little better because I had little fluids and I was so hungry. So of course I thought that going to MUSC, yeah, I can't eat and whatever. Chris, my husband supported a Jamaican restaurant. I said, right, I went get you some soup, but there was no soup. So he said, you wanna try? moving your tongue or whatever. Oof. The minute I say push in back the tongue, say push your backside back in. And I start cry again. I say, oh God, how long? How long? And I remember lying in my bed one morning and I said, this is it. I said, I can't do this no more. I said, I can't do this no more. I said, and I pray. I pray to God and I said, let me tell you something. You same one said, you ask for what you want and it shall be given. I said, I haven't, I know I've sinned, all sin is sin. But I said, what have I done to deserve all of this? What?
Mm.
No, I put my challenge out to him. I said, what have I done to deserve all of this? I said, I am a person who always help. And I always tell you, I want to help. I want to
Who
give
you
back.
talking to at this point?
No, God. No, God, me I talk to.
Okay, okay.
Me wake up, one of my young lady called me, man, and said it's prayer time. And I woke up that morning, like 3 o'clock in the morning.
Mm.
And I said it to him because my sister is a pastor. One of my sisters is a pastor, and she said there are times you have to put your challenges out there. You have to talk to God Himself. He needs to hear it from you, and it's true. And I said to
Sweet.
him, I said, listen, this is me now. I'm laying out everything to you. I said I am a servant for you, and I'm always doing your work. I may not be a Christian, but this is me. And I said I'm tired of this pain. I am tired. I'm tired. At this moment, I found a new neurologist. And he was the one who actually listens to me. He said, let me tell you something. And this is where he talks to me and let me aware what is happening. He said, behind your ears, even though we had the picture, I wasn't
Mhm.
understanding it fully. He said, behind your ears or behind your brain, I'm sorry. There's there's a nerve. It goes three-way. And as you can see right here, don't mind the writing. If you can
Mhm.
the three branches, one goes to your
Okay.
eye, one goes in your nostrils. That's your I think your sinus cavity, not playing any that.
Yeah,
And then there's a one in your what they call it, your jawbone. I
yeah.
think I got the one right here and right here. I think those are the two ones that were affected because I could feel it in my, right here too, but not that
So
severe.
these are all nerves.
Yes. So it's your nerves. If you can look behind my ears right here, there's
Yeah,
some burn. I had to wear,
yeah,
I was wearing some lidocaine patches 24/7. I wore them. So it's coming off now, but as you can see the scars and whatever, it's
yeah.
coming off now, but thanks be to God, it's coming on. I had to wear them 24/7. I kind of ease off them because I don't want my body to get used to them, just in case, in the name of Jesus, just in case another flare up should come. So, what the neurologist is saying that is not something you can predict.
Yeah, that's
No,
what I understand when I was reading
mm,
it.
you
You
have.
don't know when it's coming.
Mm-mm. Sometime it probably give you a little trigger warning by, I guess, maybe me having those twitches, was it telling me, hey, it's gonna come on. But if had I known, maybe I would be like 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 I said, or like he said, you'll never know. And I said to him, how is it that when I go to the ER and whatever, none of the doctors, he said regular doctors would not know about it, apart from me
Mm.
going there and they ask questions. So it's like it's like me teaching them, then telling them what's
Okay.
happening so they can say, oh, I had a patient with that symptom. I had a patient, but they would not know. Only neurologists or a neurosurgeon, persons who knows about your brain. And so I said, why is it that it was not picked up on any scans? He said, no scan, no MRI shows it. It's only me basing off what I've been through and telling them. So I
Um,
said, is it, I've heard, I said, what do I look, or what's going to happen then? He said basically what the first one said. He said it's something that will affect me for the rest of my life. Some persons, it won't, it'll go away for a month, 2 months, 3 months, then boom, it comes back. It can leave for a year, comes back. It can go away and never come back. But then there's rare a chance that it goes away and never come back.
Mm.
It's something that I said, what brings it on? They still don't know. Some persons, it's
They
caused
still
by.
don't know. So how old is this sickness though?
He said it affects women mostly. It can affect man, but it's mostly woman. And to their understanding, is woman over 50. I'm not 50.
I guess it changed now.
I'm near there, but I'm not 50. I'm getting there, but I'm not
But
50, right?
they need to change that clarification then. Yeah.
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 I'm also in a group, the
So
trigeminal neuralgia
just a
group.
minute, Carnage.
Mm-hmm.
So supposedly, well, eventually it will come again. Supposedly you start feeling that twitch.
You know
What's
it's
your
coming
next
on.
move? What's your next move?
Go to my neuralgia and they're gonna up the meds again.
Oh, so it's gonna be meds for your
Yes, you have choices where some persons try Botox. Is it Botox? No, not Botox. Oh God, I can't remember. I think it's Botox. The one that they put the needles. What's the one? The
oh
acupuncture.
yeah.
Sorry, acupuncture.
Oh,
Acupuncture with the needles. While you have another one where they go behind your ears. They go in your brain or something like that. Drill a
mm,
hole and there say these are the nerves clicking because I watch videos. There are videos there where they show you what they do with the surgery. It's not a major surgery, but anything with your brain, anything can go wrong. But just let's
yeah,
say it's not something that you have to stay in the hospital like a month or a year or whatever. No, they go in your brain and do something with two, they pad it so the nerves can't meet. It
together.
can be that, yeah.
Oh, so it's the nerves coming together that cause this shock
I,
and
I
illusion and
guess.
everything.
I guess I'm still learning and I'm still doing researches. I have cut certain things out my diet, as in eating. I'm on sorry. I'm on low sodium, as in way less salt. Like I said, I'm a lover of banana, so maybe the years eating so much banana, I'm just assuming,
True, that's true.
you know. So I'm cutting bananas out. Period. Like ripe, green, it doesn't matter. No banana, no banana chips. I love my banana chips. No plantain, mostly green vegetables, mostly berries like blueberries, strawberries, all of that. I'm doing that. Drinking more water. I found this doctor lady online from my sister. I can't give more information yet because I'm still trying it for myself. But
Hmm.
until I do that, I will definitely contact you and let you know where I'm doing mostly the vitamins. I get the vitamins from that particular doctor. Um it's a
So
lot.
this group that you're in, is these people are infected by the same
Oh
thing?
yes, and you have persons living with it for 40, 50, 60 years. I have learned so much from that group. And I have like spoken up and in the group, letting them know what I'm doing to kind of ease the tension about the hot rugs.
So
Because
it's
I always
mostly women in that
no,
group.
nope, you have men in there. You have
Uh,
men, and I'm talking persons from different countries, persons who have actually said they have been going to doctors for years, and to make this true, sorry, is most of them are taking the same meds as me. Some of them I'm taking way more than them,
uh,
way more. I'm taking 1,600 milligrams of one, plus I'm taking 600 of another one, plus I'm taking like 10. I think the 10% is for my migraines because I have really bad migraines. So they're trying to control the migraines because I think if the migraine come on, it's a lot. I'll rather, God, again, I'll rather have a week of migraine, even though it's not nice because of your brain, than to have that in a,
mm. Yeah,
nice.
I can just imagine. And at first I'm hearing about this sickness and
Mm-hmm.
since you told me I went to do some research on it as well.
Mm-hmm.
And it seems like it's very new, even though it's old, like the doctors still don't know what to deal with it.
No, they said doctors don't know about it. I've reached out to a foundation. Um, I was watching, I'm always on YouTube just to find out. Since I've been diagnosed with it, I want to know more, like what can do exercises and whatever. And it's not much. It's not much at all. And what the foundation is saying, they're not doing any like research. That's why I did a TikTok video, and I also put a reel on Facebook. I don't know if it's gonna come down or whatever, but I was planning. I hope to get more views on this video because a lot of persons have never. When friends saw my TikTok video or whatever, my Instagram, they be like, "What in the world is that?" And I said, "All right, I'm gonna do a video just to let persons know how am I doing." Well, I've
Yeah,
not been outside for 3 weeks. Apart from the doctor's video, I am so scared. It makes me so scared because of the wind. I don't know how my body is gonna. I'm scared. I'm not telling you no lie. I'm really scared. The other day, I take a leap of faith. My husband called and said, "It's pretty nice out there. I think you should go. Just put something and go out there." And I tell you no lie, Chris. I went out back way, well sideways, and the wind was blowing. And I stood out there, and it felt so good. But at the end of the day, with the breeze, I don't want to go back there. I don't. I don't. It's scary. It hurt. I don't want to go back out there. I just want to get my life back because this thing robs you your life. And being on the group, I've spoken to so many persons, older persons, and they said they have not been the same since they have had the first attack. And the worst part of it that scares me, they said every time you get an attack, it gets worse and worse. How can you live with that? How?
yeah, yeah. So is this you think this is caused by dietary? You think is what you eat causes
I
in your
personally think
opinion?
from my opinion, and I personally think that my flare up was caused by stress. I believe that. I'm not playing
Mm-hmm.
doctor again. I'm just telling you based on what I've experienced with mine. I was going through a little um I would say depression state, then a little stress at first
Mm-hmm.
because I stopped working and I was going school, and then it was time for me to do an exam, state exam, and I still can't do it because the same time I was starting to do some studying, boom, the symptoms start to get severe and severe and severe. Then I had the flare up. I still haven't take up a book and say, okay, it's time to study because of the whole flare up thing. I'm still trying to adjust. And then now I'm on these meds. It's not a new meds, it's a new meds because but the new neurologist said the meds that I'm on at 1600, he's trying to get me down from that one because that one makes you addicted.
Mm-hmm.
And let me tell you something, every 6 or 7 hours that I'm supposed to take it, I start feeling my jaw. I said, God, it's time for me to take my meds. So it's like my body's drawing to it, or it's already, you know what I mean? So
Yeah.
his him and I said to him, I said, what are your plans, for me and my health wise? He said, first, I need to get you, I'm going to have to put you on a high dose with this one. And mind you, I'm taking one of that. That's 600 milligram. And I'm taking one of that. And that side effect with the 1600, I'm blurry, like I have double vision at the moment. I can hardly I have what they call it disorientation where this minute I don't know how to explain, but I know it's not my real self, if you know what I mean. I've been
Yep.
sleeping this morning the whole time. Some days I'll be sleeping, some days I'm not. So I'm kinda, I don't know, it's just, but the blurry vision is one of my main focus and concern because I can't drive. I can't
Mm.
drive at the moment. Sometimes I have slurred vision. Sorry, not vision, slurred speech. Sometimes it's just a whole different. And that's what he's saying. He's saying with all these, with the meds, I can't allow you to work at the moment because you probably be at work and you have a flare up or, you know,
Yeah.
and based on how
Puzzle.
it's so based on I have to give you some time for you but to see how your body reacts. Maybe he's gonna up it more just to take me off the other one. I'm not sure. So for now, he said it's not something that I can cure or for yet for now because we're still trying to figure this thing out. But we gonna put this thing under control. You have to. So I'm just hoping for the best and hey, it is what it is. But I'm just trying to watch my diet more, you know, try to exercise some more and just try to stay healthy. That's all I can do.
Man, there's so much. It's like,
Mhm.
and at a time like this when your life to change 160 space
Jesus.
up. Cause I saw you like a few weeks on vacation.
Mm-hmm.
And for anybody that knows, you know that that's not how your face looks. And
Mm-mm.
people can look at, I have a thumbnail up with your pictures before
Mm-hmm.
and after. It, man, it just
You heard.
shocking. It was so shocking how you just
Yep.
transform so
And
fast.
another thing too. I think alcohol has a lot of stuff. I'm not a big drinker of alcohol, honestly. I just do it occasionally. So when I went on that little mini vacation too, and I was just trying. No, you're talking. I'm looking back. When I went on that vacation, I, you relax. You let your hair down. Just you're out with your husband and family, so you're gonna have fun. I didn't overdo it, but I think I overdo it. If you understand what I mean, it's not. I
Mm,
was drinking every single day, no, but the night before, night of the wedding, we were having so much fun. So I was drinking, I was taking shots. I think I was drunk too. So maybe that's a lot to that helped push it over to the curve, like, okay. And spiritually, couple weeks before I went on vacation, there were a lot of stuff I was seeing. You remember what we were talking yesterday before we even talk about the live, that I was telling you, what if I tell you I can see certain stuff, whatever.
mm-hmm.
I went to Jamaica earlier on last year, and from I came back from Jamaica, it's like I don't have no taste for alcohol, no taste. And I would just drink some wine occasionally, nothing. And for some strange reason, because I went on the vacation, I just decided maybe God was, telling me, hey, you need to keep off it. I'm just saying what I feel. So maybe
Mm-hmm.
sometimes we need to follow our mind. That little place inside here that tells us don't, and then you have this big old part that's saying yes, follow that little part. Because sometimes that little part is the part that gonna save you or gonna help you. Who knows? But I learned a big lesson though, and I will tell anybody this. Stress is not good. And I learned it the hard way. I might not be crippled, I might not. You could be home and you hear that, hey, you don't hear that Carnisha died. What killer her? You know? Who
Mm-hmm.
knows? So
True. But Carnation, it's hard, at, especially the times we're living in right now. It's hard to tell somebody don't stress or not to stress because
yeah.
every day is something new, especially what's in our world, at this in our country,
Mhm.
what's
Yeah.
going on. It's like people are losing their job. Things are getting so
Mhm.
expensive daily,
Mhm.
hourly. People are being homeless. It's hard to say,
Mhm.
man, stress is not the key. But when when you're a person that normally works for your own,
Mhm.
you go get your own, you don't sit and wait. And
Yeah.
then doctor comes and tell her, hey, you
You
gotta chill.
can.
Yeah,
You, you know what
So
keeps me? When like I said, the three times that I made the attempt or whatever, I cried about it and I'm not ashamed, because maybe this can be something that helps somebody, who to tell.
yeah,
But in a time like this, like you said, when the doctor said, I'm sorry, I have to write you a letter, you can't work because of your whole symptoms. I just looked at it and I said, you know what, maybe it's for something for me to analyze myself and to be at peace, just to talk. I know I have bills and stuff, but my family again, my mom never leave me out every day. And she's always encouraging me
moral
and say,
support.
even though it's hard, even though it's super hard, we all know. But you see, you have to have somebody in your corner who you can talk to.
That's
It
true.
doesn't matter how small it is or how big it is, you have to. And you see, talking, I know sometimes you don't even know who to trust nowadays, but at the end of the day, you have to have somebody who you
That's
trust.
true.
No judgment. And I am always that type of person. And I said it to my best friend. I said, I feel really bad. I feel like a handicap now. I can't talk to anybody, but persons have to listen. She said, "It's your time now to let go. Let somebody help you."
That's
That's what she
so.
said. And it's true. I've always been that person. They always call, "Hey, da 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 da." They keep talking. And I'm always listening. I'm the type of person, Chris, if you call me to talk to me, I'm gonna say, hold on, you want the truth? Because I'm not gonna play no hypocrite. I'm gonna tell you the truth. If you're wrong, you're wrong. You understand? I'm always the listening one. So it doesn't matter how hard the economy is, it doesn't matter how whatever, sometimes God put you in certain position to slow you down.
True.
Slow you down. And maybe that's the reason. You
Yeah.
know,
True.
I don't like the pain I was in. I didn't like the pain I was in. I was in such hard pain. And I tell you, it took mental health and prayer to bring me back here mentally. I promise you. I promise you. I was gone with that pain. That pain. Any doctor, I tell you, three doctors asked me, "What's your pain level?" I said, and I wrote it down. There is no 10 to this pain. And I will walk and tell any neurologist, new surgeon, or whatever, they'll talk about, "Oh, this is not," like they probably saying, maybe it's not that bad. So they're not going to put any research. If it takes me as one of the first person to do draw awareness of this sickness, I'm going to do it. Maybe it's for a reason.
Yeah.
But people need to be aware, because if I had known that I was coming on to a flare up, if I had known it was that, they talk about it's not severe, I promise you, this ain't no joke. This is not no baby pain. None. No
Mm.
baby pain. Me peep up myself and me not scared to talk. Cause me not have no control when the pain lick me. And when I
Mm.
look and I told my husband in front of my 5-year-old, "I'm done. I can't do this." When I saw that, I called my mom twice and asked, I beg her, I said, "Please pray with me. Don't come off of the phone." Days upon days, every morning, 7 o'clock, I have to call my mom and say, "Stay on the phone with me because I'm so dizzy. I'm so high." Come on. Who wants to say that way? I'm not a junkie. We had to call ambulance some because I was so weak because I couldn't eat. Feel like I was sleeping away. And my mom cried. And when I hear my mom crying, I say, "My daughter, I don't want her to die and I'm not there to help her." I have to fight that feeling. And I have my 5-year-old in the house with me. You have to find somebody who to talk about it. And I learned my lesson. I learned. Talk. There's sometimes we think that nobody will understand. Oh, I promise you. Just talk. You're no business if they want to understand. Talk. If you have the money, pay. Go pay and get help. But talk. I learned it the hard way. And I strongly believe stress was one of the contributor to my flare up.
And
Strongly.
you
Hmm?
think that when I say you think that is because we weren't talking, it
I
get
was I
it
was
emerged.
talking, but the stress level I was at with some of this stuff, it's not like I wasn't talking. It was just that I still think about it. I kept it in, and like you said, life. You're not working because I just got a new job, Chris. Just the right job, not the right, but the one that I had with benefits and all that. I just got two. That was the same week I got sick. That was the first week I got paid. And tell you what, they let me work Christmas Day, and I started Christmas Day. Started working Christmas Day.
Mm.
And I worked New Year's Day. And come to find out they weren't gonna pay me double pay because I have to be in the company three months. Or 90 days. 90 days before I get um family pay, holiday pay. And I got pissed off too.
Mm.
But because I needed a job. I need better than want, right? Or I want better than
Yep.
need. Oh, I
Need.
needed a job.
Yep. Yep.
So all of that just come down and tumble down. And I'm a person like this. If you call me and say, "Carnisha, some head that hurt me," I'll take up your problem, put it on my head, as in that way, because I would love to help you. So I guess it was time for me to let go. I had clients who was sick, and even though I leave them, I was still worried about them. It was time for me to worry about my problem. which was right there, but I didn't stop to do it. I was just trying there to help persons mentally, but it is
Hmm.
what it is. I learned though. I learned.
Yeah, that's the greatest thing about it. You learn from it. So
Yes.
you can actually teach someone and
Yeah.
show someone what you've been through.
Mm-hmm.
Yeah, it was really fun, Carnisha, and I'm really, really happy that I see you in a better space.
Yeah.
And all the videos I saw on TikTok with you and the way you looked and the way I know you was before,
Yeah.
it
Mm-hmm.
was shocking
Mm-hmm.
that, as you said before, nobody can never prepare for sickness or
No.
pain.
No, sir.
And until someone be in the shoes, they will never know what you're feeling,
Yeah.
what you're going through.
Mm-hmm.
And I'm just glad prayer got you through it.
Yeah.
And God is the only one that can help. And if
Oh
we put
yeah.
it to Him, He will help. You know?
Mm-hmm. Yes.
So I'm gonna follow up with you again and
Yeah.
find out how you're doing.
Yeah.
Definitely. And I
Mm-hmm.
just want to salute you.
All right. Thank you so much.
And God bless you, Con.
All right.
Until
Thank
then,
you.
yeah.
All right, darling. Yeah.
Bye. Yeah, guys. So that was Carnisha. She fell ill to a crazy, crazy sickness. It is so strange, you never know. You know, that's why in everything we gotta give thanks. We gotta give thanks for things we see, unseen. We gotta give thanks for our going out and our coming in. Because believe it or not, whether you believe it or not, there's a God. And whether you believe it or not, sickness and death is sure. But at the end of the day, it's up to you. You know? And as I go, I want to say one love and always remember, be grateful. Family is the next thing or the next best thing to God.